Okay, let's unpack this. We're diving into a topic that's incredibly challenging for so many people, parents, teachers, really anyone trying to understand kids' childhood aggression.
Yeah, it's complex, definitely. And,
Yep.
it can be quite scary. Understanding it's just so important.
Absolutely. And for this deep dive, we're working from specific material, right?
That's right. Excerpts from a book called Rage-Free Kids, Homeopathic Medicine for Defiant, Aggressive, and Violent Children. It's by doctors Judyth Reichenberg-Ullman and Robert Ullman.
Got it. So these sources take a particular stance, exploring homeopathy as a potential alternative way to handle these really tough behaviors in children.
Exactly. So our goal here really is to dig into what these sources are telling us.
Yeah.
How do they define aggression? What factors do they say contribute?
And what are their views on, say, conventional treatments, the limitations they see?
Yes, and then how they present the homeopathic alternative, plus any sort of practical advice they offer parents right there in the text.
Okay. So think of this as us walking through this specific material, trying to get a clearer view on a huge subject, pulling out the key ideas, and maybe some surprising bits along the way. Let's jump in.
Right, so one of the first things the sources stress is that aggression isn't like one single thing. It's presented as a really wide spectrum of
A
behaviors.
very wide spectrum, yeah.
Yeah.
They mention everything from, verbal stuff, bullying, all the way to, well, some pretty severe examples like physical fights, robbery, even homicide are cited. It covers a lot.
And it includes defiance, specifically traits they connect with oppositional defiant disorder, ODD. The authors use terms like hotheads, fiery tempers.
Right. Kids who hate being told what to do, argue constantly, blame others, and often underneath it all, low self-esteem.
Yes, and the classic things like temper tantrums, breaking things, antisocial behaviors. And a really striking point the book makes is this common lack of responsibility or guilt.
That idea that they often see themselves as the victims, like he started it or they're always picking on me.
Exactly. And here's something really interesting, kind of surprising actually, from these sources. The book suggests parents often see signs incredibly early, like toddlerhood, sometimes even infancy.
Infancy,
Yeah.
though?
It mentions specific signs of frustration, even rage. Specific facial expressions identifiable by just 3 months old.
3 months. Wow. So this perspective suggests it's not always just a phase that pops up later. For some kids, the indicators might be there almost from the very beginning.
That's the picture painted, yes.
Okay, so we have this broad definition. What about the roots? What do the sources say causes this aggression?
Well, they point to a whole range of contributing factors. It's rarely just one thing. According to the book, we can sort of group them. First off, early experiences and the family environment seem to play a huge role.
Things visible early on, like maybe a child not bonding well?
Yes, that's mentioned. And they also touch on some, well, less mainstream ideas, like suggesting that violent thoughts held by parents, either during pregnancy or after birth, or even a difficult birth, could potentially trigger violence later.
Interesting. What about more typical environmental factors?
Oh, yeah, definitely. The impact of parental behavior and conflict is really highlighted. Things like mother-child conflict or just significant discord between parents, even if they don't
Like
divorce.
socioeconomic status.
That's mentioned too, yeah. Linked to conduct disorder and delinquency in some cases. And also things like unsupportive families, maybe trouble coping with stress, less focus on personal growth. Those are listed as contributing factors.
And crucially, things like harsh or inconsistent discipline, neglect, abuse, physical, verbal, sexual.
Right. The book makes a very clear point. Violence in the family often leads to violence in the kids. There's a stark statistic cited. Children exposed to violence at home are, I think it was 3 to 9 times more likely to be injured or abused themselves.
That's sobering.
It is. And peer abuse, like bullying, is also mentioned as potentially inspiring violence.
And chronic stress from neglect early on.
Yes. They suggest that chronic stress from early neglect could potentially undermine learning and focus, sometimes leading to violence down the line. There's also a connection made to parental issues, like sociopathy or criminality.
You mean like if a parent has a history?
Exactly. They cite an adoption study suggesting nearly a 2 times higher risk of criminal behavior in kids if a biological parent had such a history.
Okay, so that covers environment and early experiences. What about biological factors, genetics?
Well, the book says there's no single violence gene, but it does acknowledge that biology and genetics play an important role. And this is where they link aggression to mental illness and physiological imbalances.
Right. They estimate, what was it, 12 million kids suffer from mental illness, many not getting help.
That's the figure cited, yes.
Hmm.
And the list of psychiatric diagnoses they associate with aggressive behavior is, well, it's long.
Yeah, I saw that. Common ones like ADHD, conduct disorder,
Mm.
but also things like psychotic disorders, traumatic brain injury, seizures.
Right, and mental retardation. Pervasive developmental disorder, PDD, depression, bipolar disorder, PTSD, ODD again, dissociative identity disorder, panic and anxiety disorders, borderline personality, autism.
It really shows how aggression can be a symptom of so many different underlying conditions, according to this perspective.
Exactly, and they don't stop there. Physical conditions are mentioned too. Head injuries, seizures, brain tumors, substance issues, even premenstrual dysphoric disorder.
And specific physiological triggers, hormones, serotonin.
Yes, they mentioned potentially higher levels of hormones like androstenedione and testosterone, and issues with serotonin function as factors that might be relevant, perhaps sometimes overlooked.
It's interesting. Do they explain the mechanism, like how hormones might connect to rage in detail?
The excerpts we have don't really dive deep into the how of the physiology. They're more presented as, potential pieces of this really complex puzzle, factors to be aware of based on their research and clinical experience.
Got it. So part of the overall picture, okay, one more big category of causes they mentioned, media influence.
Yes, and they present this as a significant factor, really emphasize it.
That statistic about kids potentially seeing over 10,000 TV murders by age 18, that's pretty shocking.
It is. And the idea about video games, not just desensitizing kids, but potentially even training them for violence, as the book puts it.
Right, and they cite studies apparently showing correlations with aggressive behavior, fear, desensitization.
And they make this observation about American TV specifically, that violent scenes are often shown without consequences, sometimes even with humor mixed in.
So pulling all that together, the picture they paint is this incredibly complex mix of environment, biology, maybe some underlying conditions, and external influences like media, all potentially feeding into childhood aggression.
It's definitely not presented as a simple issue with a single cause.
No kidding. So just how widespread is this? The sources use some pretty powerful statistics to show the scale of the problem.
They do. Let's touch on the scope. They include things like data from Washington State, where at the time of writing, 21% of kids reported physical abuse by age 12.
21%.
Yeah. And mentions of concerning trends like handgun access and how things like domestic violence arrests, CPS referrals, teen arrests for violence, and teen homicides reportedly doubled or tripled over 10 years in some areas back then.
And that comparison, the U.S. having the highest youth homicide and suicide rates among 26 wealthy nations, that really stands out.
It's a sobering point they highlight.
Yeah.
They also pointed to past increases in murder arrests for young boys, like over 200% for 15-year-olds, 100% for boys 12, and under over a certain period, though they do acknowledge a decline since 94 when the book came out.
They mentioned specific school violence incidents, too, from the late 90s.
Yes. October 97 to May 98, 14 students killed, 45 injured, and FBI data suggesting adults actually kill 3 times as many juvenile homicide victims as other youths. That's often overlooked.
Wow. And the figures on rape arrests for kids under 12 increasing between 1980 and 1996.
Right, from 222 to 553. And the prevalence of conduct disorder, CD estimated near 10% in urban areas, according to figures they cite.
And that link between early CD and later offending, that's stark. 40% of 7-8-year-olds with CD in one British study became repeat offenders.
And conversely, over 90% of repeat offenders had CD when they were younger. And one last figure, an estimate of 160,000 developmentally disabled individuals in the U.S. exhibiting destructive behaviors.
These numbers really do hammer home the seriousness and the scale of what this book is trying to address.
Absolutely. Now, shifting gears a bit, the book, coming from this homeopathic perspective, looks at rage differently. Not just as bad behavior, but as an expression.
An expression of deeper feelings.
Exactly. Deeper underlying feelings that they argue need to be understood.
Okay, so what kind of feelings are we talking about according to the sources?
Well, they suggest rage might stem from things like profound loneliness or a feeling of being fundamentally unlovable. The idea is that a child lashing out might actually be pushing people away, while deep down they're desperate for connection.
That makes a certain kind of sense.
Huh.
What else?
Feeling cruel or feeling like a victim. They suggest sensitive kids might internalize cruelty they experience, or they might act it out. Powerlessness is another big one they mention.
Powerlessness leading to malicious acts.
Yes, especially perhaps in children who've experienced repeated abuse, feeling helpless and then striking out. Betrayal is another, feeling wronged, treated unfairly. Maybe jealousy leading to revenge.
Hmm. And general irritability.
Yeah, or hypersensitivity.
Ah.
Kids who seem angry about everything. The book suggests maybe they're just hurting inside, overwhelmed by the world.
And then there's self-loathing. That sounds really deep.
It does. They highlight it as a particularly disturbing core issue, especially in teens, and link it often to suicidal thoughts or attempts. Fear is another one mentioned.
Just general fear or specific fears.
Could be either intense terror, maybe specific, maybe more global, often potentially stemming from early abandonment experiences, they suggest.
And finally, feeling stupid.
Right. They note this is common, especially in aggressive kids who also have ADHD. The struggles with attention, social skills. It leads to immense frustration, feeling out of control, which then might explode outwards as aggression.
So this perspective really pushes you to look past the behavior itself, doesn't it? To try and understand the emotional storm underneath.
That seems to be the core idea, yes.
Yeah.
Which naturally leads into how they view treatment, especially compared to conventional approaches.
Okay, so conventional treatment. The book mentions things like drug therapy, counseling, psychotherapy, behavior modification.
Yes, the typical approaches. But it voices some pretty strong criticisms of how the conventional medical model often handles aggression.
Right. A key point seems to be that there isn't one single medication for aggression itself.
Exactly. And that often kids end up on multiple drugs, which the authors describe as potentially toxic. Frequently, they argue, without getting to the real root cause of the behavior.
And the side effects are a major focus of their concern.
Huge concern. They list things like appetite loss, sleep problems, headaches, stomach aches, even potentially life-threatening allergic reactions.
And while some might be minor or reversible, they note that for some kids, medication might end up being a lifelong thing.
Yes, but the absolute core criticism they keep coming back to is that conventional meds, in their view, mostly just control symptoms. They don't cure the underlying problem.
And they quote experts lamenting the lack of truly effective treatments specifically for conduct disorder, saying meds alone often aren't enough.
Right, and it's against that backdrop that the book really champions homeopathic medicine as what they call a safe and effective alternative.
Okay, so let's unpack the homeopathic approach as they describe it. The core principle seems to be this focus on the whole person.
Exactly. Physical, mental, emotional, all interconnected. The aim is described as achieving a deep, long-lasting balance, not just suppressing symptoms.
And it's highly individualized, right? Not just treating the diagnosis, but the unique child.
Very much so. They emphasize tailoring the treatment to the individual child, looking at their specific feelings, motivations, those underlying issues we talked about.
And safety is a big selling point they make.
Yes. They describe the medicines as safe, very gentle, with few side effects compared to conventional drugs. The book explicitly says homeopathy won't make a child depressed or sleepless or take away their spark.
Their personality.
Right. And the authors report significant success, what they term dramatic success, in treating over 1,500 children, claiming parents saw big positive changes, sometimes within weeks.
And the remedies themselves. Tiny sugar pellets. Highly diluted substances.
That's the description. Prepared through serial dilution and succussion, basically, a process of repeated dilution and vigorous shaking, which homeopaths believe transfers the substance's energetic pattern.
Okay. And they mentioned something about symptoms potentially getting worse initially.
Yes, a temporary intensification, which they call an aggravation or healing crisis. Importantly, the book presents this not as a negative side effect, but as a positive sign, part of the natural healing process as the body responds.
Interesting perspective. And it takes time. Consistent treatment.
Yes, they stress that. Often at least a year is considered necessary for lasting improvement.
So it's a fundamentally different philosophy presented here. Personalized, root cause focused, aiming for balance with gentle remedies, contrasting with what they describe as the symptom management focus of conventional drugs.
That's the core contrast they draw. Now, besides the whole treatment debate, the sources also give some very practical advice for parents who are actually dealing with aggressive kids day to day.
Right, practical strategies. What do they suggest?
Well, first, they strongly encourage parents to read the book and understand this whole perspective before jumping to medication.
Okay. And understanding those underlying feelings we discussed. Looking beneath the rage.
That's reiterated as crucial, yes. And then, very practically, setting clear boundaries and being absolutely consistent.
Meaning clear, fair rules and consequences that actually teach rather than just punish harshly.
Exactly. Appropriate consequences that teach responsibility. And a big one, Praising positive behavior. They use the term lavish praise. Really focus on the good stuff.
That makes sense. What about the parent's own reactions?
Critically important, according to the book. Managing your own anger. Avoiding aggressive reactions yourself. Being a role model is vital, showing honesty, compassion.
And communication.
Huge emphasis on open communication. Creating a space where kids feel they can talk about anything without being judged. They even suggest regular weekly family meetings.
Like a dedicated time for everyone to share respectfully.
That's the idea. A weekly forum,
Yeah.
and also creating a home environment that generally supports learning and growth.
Okay. Is there a point where they say, look, you need outside help?
Yes, absolutely. There's an important caveat. Knowing when to seek professional help is essential, especially for chronic, really serious issues like diagnosed psychiatric problems. They explicitly state that self-treatment with homeopathy isn't recommended for those severe conditions without professional homeopathic guidance.
Got it. So it's a mix of parental self-awareness, consistency, positivity, communication, knowing your limits, and potentially exploring the treatment avenues they discuss.
It's quite a comprehensive set of strategies layered on top of the treatment philosophy. And ultimately, the book wraps up with this, well, really aspirational goal:
Which is?
to make violent acts by kids and adults a rare exception, to find healing for everyone touched by violence, and ultimately to promote love and peace.
That's quite a vision to end on.
It is. So looking back at this deep dive, we've gone from defining aggression to exploring this really complex web of potential causes laid out in the sources.
To examining their critique of conventional approaches versus the homeopathic alternative they propose, and then summarizing that practical advice for parents. It's definitely a lot to take in.
It really is. And it offers a very specific viewpoint, doesn't it? Rooted in homeopathy, focusing strongly on those underlying emotional states.
Which kind of brings us to a final thought, perhaps for you, the listener. Given how multifaceted childhood aggression clearly is, and seeing these, well, quite different philosophies on understanding and addressing it,
Yeah.
how does digging into these specific potential causes and treatment ideas, as presented in this book, influence your own thinking about how you might support a child who's struggling?
Yeah, and what does that idea of treating the whole person, really looking beyond just the behavior, what does that actually mean in practice when you're faced with something as intense and difficult as childhood rage? It's complex, but maybe understanding these different facets, even through the lens of this one particular source, is a necessary first step. It reminds us there are so many factors and, as this book suggests, potentially different paths to explore when trying to help.